Good day, everyone. Doc Mika here, and we will be discussing Module 7, which is fracture management and emergency coaptation. Right? I needed to indicate that this is emergency coaptation and not therapeutic coaptation, because the approach for large animals, specifically, I will be focusing on horses for Module 7. Is very different from treatment of coaptation pagdating sa small animals. All right. Why are we talking about fractures? Why are we talking about this? Okay. The most common encountered emergency in the athletic horse, the race horses, or whatever what do you call this event they are what do you call this, competing for, dressage, jumping, or is it racing. The most commonly encountered emergency would involve the musculoskeletal system, and these may include fractures, luxations, lacerations, puncture wounds, infections, and in some cases exertional rhabdomyolysis. Right. Other injuries would be head and ocular injuries. And although most of these conditions cannot be treated in the field, the accurate identification and provision of appropriate treatment in an emergency setting are essential for you to have a successful outcome. And if we are going to be confined in a Philippine setting, we do not need to actually talk about fracture management, because when you see a lame horse and you could visibly see a fracture, a broken leg, okay, immediately the treatment, the management are moot, and this horse now faces euthanasia, right? But we'll get to that in a bit. How do we evaluate the fracture patient, right? If you are the handler, if you are the veterinarian, which you are rarely there for the race, usually. You're there for the training, but not for the race. There are some things that you have to do, right? You have to identify the fracture site, which means you have to be not just knowledgeable, but you not just familiar, but you have to master not just the anatomy of the musculoskeletal system, which includes bones, muscles, joints, tendons, and ligaments of the horse, but also the dynamics of these anatomical structures, especially when we're talking about a racehorse. How a joint flexes and extends, what is the angle that it needs to be, all those things. And if you are interested in being an equine practitioner, that's where you will be specializing on, right? Fracture classification. If you remember the way that we classify fractures in surgery 2, we discussed if there is an open wound. So is this fracture open or closed? Is the fracture complete or incomplete? Meaning, in a complete fracture, both cortices of the bone throughout its circumference would be broken. If it's incomplete, only one cortex would be broken, right? What else? Is it comminuted? Is it transverse? Is it spiral? Basically, the direction of the break, right? So these are just some of those ways of classifying fractures, which would enable you to fully evaluate your patient. Animal's condition and temperament. This is one limiting factor, basically, when you talk to an equine practitioner. Kung magpupush pa sila na i-treat yung horse, or they will just euthanize the horse, right? The horse, when you get fractured, if any one of you has popped your shoulder, it is very, very painful. And this is a very big animal. So it is very hard to control them once they are, what do you call this? They broke something during a race, right? I think we have a video right here. Now try to see where the break is. We're talking about a leg. Go distally. Focus on the left forelimb. Yep. See how it sways? It's non-weight bearing right now. It's they're not gonna show the part where they gun it down, okay? It's just they call this. It's very easy to see once you are in the racetrack to see that your horse has broken a leg, and that is heartbreaking for those owners, for those handlers, to lose a horse just because of a bad fall, or if they what do you call this? One common reason bakit nagkakaroon ng injury ang horse during the race would be they bump into another horse and then they fall. And then the way they fall would cause the bone to break. Right? But there's a lot of that's why there's a lot of things that contribute to that as well. Right? So how do you evaluate the condition of the animal? Is it aggressive? Is it just in pain? Can it be handled? Do you need to sedate the animal? Or would pain meds would be enough? Okay? Remember, if the fracture, any luxation, is not as evident as this one in the video, kung kailangan mo ng x-ray diagnostics just to confirm a break, then maybe the prognosis for that fracture is better as compared to this horse, wherein you could easily see that I am not sure if it's the coffin joint or the pastern joint, which was basically severed right there and then. Okay, the level of injury. Anatomically, there are levels of injury pagdating sa horse. We'll discuss this in a bit later, but this is what do you call this? Certain part of the leg which has the injury would have a certain level, and that level would dictate the coaptation that you need to do for that injury. Okay? Need for stabilization, kind of dinaanan natin to kanina. Okay? Basically, how do you call this? For your horse to be stabilized, pain meds might not be enough. For some, it is enough, but usually your go-to is pain meds leading to sedation. All right, that's how you stabilize, and also that's for the whole animal, but also the need to stabilize the displaced or broken bone. Remember, the distal part, okay, the distal part of the horse, okay, from tibia down, okay, tibia down, radius down, okay, that is a very bony area. There's not much muscle in there as compared to the pelvis and the shoulder joint. Okay, so what they call this, when a bone breaks from the tibia down or the radius down, that is a very unstable fracture. Okay, because you do not have that much soft tissue in that area na pwede pang magpad or magcushion around the broken bone. Okay, pagdating sa horse, there's nothing there. It's just tendons and ligaments. And basically, If it breaks, you could easily see it, right? And once you are done with an initial evaluation, and usually that is enough, you can decide if this patient will be euthanized or not. Okay? Susugal ka ba na i-treat yung fracture, you put a cast, you do surgeries, or you simply euthanize the animal? Or for a lot of racehorses in what country am I thinking of? Australia. They donate the horse to a university, for the university, the College of Veterinary Medicine, to do their, experiments or try to do those surgeries. Because if you have a racehorse, you are keeping and spending money on that racehorse for it to race. Okay? Once your patient is showing luxations, signs of arthritis, or a break, even just a small break in the splint bone or in the cannon bone, you know that it may not return to its normal, statistics, performance levels, okay, in racing. Okay, you know that maybe you're just gonna keep it for breeding because it's a very good line, it has a good pedigree, right? So those factors, the owner would decide that. The veterinarian would just say, not worth the money. Let's just move to the options that we have. Donate the animal, keep it for breeding, manage the wound or manage the fracture. If it can be managed and it can be treated, but this horse will not go back to its normal performance or even be trained to regain the function of the limb, then, all right. Clinical fracture assessment. All right. Let's start with the location of the fracture. I hope you still remember your anatomy when I show you this leg. All right. Is this a forelimb or a hind limb? Come on. It's the scapula is very clear there with a very thick, distinct scapular cartilage. Right? I'm not gonna ask if this is left or right, but I think that's pretty, what do you call this? Obvious as well. Diba? Anyway, okay. When I point to such bones, I hope you still remember them. This is the quiz, basically. I'll just post this in a Google form, then have you write it. Please. Okay, I'm gonna insert this part here in this slide. Right? When I give you instructions, they are to be followed. Right? I don't want you messaging me and then you're gonna tell me problems have arisen, because you simply did not follow the instructions. There is a reason why I put instructions in the quizzes, or we have only had one quiz in the exam. Basically, it's for my organization and for things to be easier for you. But if you want to make it harder for you, it's just very frustrating. All right. So review on your anatomy for these bones and for the muscles in there as well. All right. I know you still, I remember you still got to dissect a horse, if I'm not mistaken. Yeah, you were able to dissect a horse. So I hope you still remember the muscles here. Basically, make what do you call this? Make a dog anatomy way bigger. Ganun lang naman yan. All right. Next. The chief clinical sign for long bone fracture, all right, would be non-weight bearing lameness, which is of a sudden onset or acute, with signs of distress. And distress can be manifested by the horse through sweating, excessive sweating, tachycardia, tachypnea, right? And fractures are always suspected in cases of, number one, a loud crack is heard. And trust me, you can, even if there's a race happening, if you're in Santa Ana, where else? I just got to Santa Ana before. You could actually hear a loud crack, right? It's just so happened that when we were doing our clinics we were accompanying our equine practitioner slash professor to Santa Ana for extension. There was a race. We cannot bet on anything, even if we know who's the best there. There's a loud crack. Yes. And the thing is, of course, they stopped. A lot of people. And then you hear a gunshot. You actually see the gun there. They carry a gun. I don't know where they got the gun. They have a gun, pointed on the horse's head, and shot it. I didn't look, but I saw the when they whipped out the gun, and our professor said, "You can look, but you can turn around." And yeah, they euthanized that horse in the field. If I remember, that was a where was that break? I think it was on the metatarsal. I remember if it's left or right. It's a metatarsal bone. The horse fell. Mali yung ikot niya, I think. So, natumba siya, and then, pag tayo niya, wasak na yung hind limb niya. Ugh. It's just so graphic, guys. And if you want to see a lot of videos of that, there's a lot on YouTube as well. Alright? Abnormal limb angulation. Limb is visibly unstable from its normal conformation. But it's not always fractures. Okay? What are other differentials for severe lameness? Okay? Kapag nakakita ka ng non-weight bearing na horse. Right? Joint luxations are very common even during training of race horses or of jumping or dressage. Solar bruise or septic arthritis. Okay? Now, when you see this animal, if the horse is standing, okay, if the horse can still stand, the rule is you do a limb assessment first before you move it. Okay? Even if you're in the middle of the field, even if you're in the middle of the turf track, you assess the limb first. You do not make the horse move while you haven't checked if the limb is broken or not. If the horse is recumbent though, you have to do your limb assessment before you make the horse stand. All right. Remember, and when they stand, you're gonna put weight on that leg, and that will cause some difficulties with your confirmatory process pagdating sa fractures. All right. Okay. How do you restrain them? Number one is twitch. All right. Maybe beneficial is initial restraint, especially if the fracture, or if you're not sure it's a fracture, if you just see the horse is lame, and you just want to do your lameness exam. Yes, you can do a twitch, but sometimes horses would move more violently during the tightening of the twitch. Remember the twitch? You have the rope, you're going to tighten it to the nostril. Okay? And that could lead to further injury if the horse is not tolerating that. Okay? And number one, sedation. Alpha-2 agonists like psilocin and ditomidin are the go-to. You can use a minimal dose to reduce ataxia in horses with suspected forelimb fracture. When you use psilocin and ditomidin kasi, this usually leads the horse to shift the weight more into the forelimbs, so it will cause the horse to lean forward. So if you are suspecting a forelimb fracture, you just use a minimal dose para hindi siya mag-lean forward. Right? A higher dose may be used if this is an excited horse, a distressed horse, or if you observe that lameness and you think it needed sedation, if it's right after exercise. Okay? Because it will take, as literature said, you would need a higher dose for that. Okay? Pain meds like butorphanol may be added, and if it is recumbent or you suspect that the injury is very serious, you can sedate with Sila, induce GA with ket and dye, or you just use Sila again. Okay? And as some of you has pointed out, I think you're learning how to answer my questions in the exam really well, right? You have pointed out that silazine is the only drug available in the Philippines. Very true, but I know of one who was able to get ditomidin, but he he doesn't want to be named because he doesn't want to be asked how he got it. I think he smuggled it in. I don't know. But Detomidin is in the Philippines. Meron Detomidin sa Philippines. Hindi lang siya masyadong ginagamit. And of course, since it's quite expensive, it is only manufactured by Zoetis. Xylazine has a lot more manufacturers and it's cheaper. That's why you still go with Xyla. And before sedation or anesthesia, classic assessment of the circulatory system must be done. Evaluate heart rate, mucous membrane color, CRT, pulse quality, and you do this fast. All right. Yeah. For now. This is an emergency module. Okay, let's see what happens here. Oh.
As well in third, arms runner just took a back step. Arms runner went down, and so did Lance Sardan at the dirt crossing. They're in the final furlong, and law-abiding citizen. As well in third, arms runner just took a back step.
Two horses bump to each other.
And so did Lance Sardan
Yep.
at the dirt crossing. They're well in third, arms runner just took a back step. Arms runner went down, and so did Lance Sardan at the dirt crossing. They're in the final furlong, and law-abiding citizen.
Saw that? You want to repeat that? Yes, graphic. One more. Let's see the... Alright. From the left, fell, tripped another horse. The other horse is fine, but the white one... Sorry, it's not white. Okay. Right forelimb. Looking like the hawk. Looks like the hawk joint. Ugh. Right? And if that was you, as a vet, as a vet of this racehorse, parameters, right? When you're gonna consider euthanasia. Number one, open, comminuted fractures with severe tissue damage, right? And for these, sometimes, actually, most of the time, you do not need an X-ray to identify it. Let's X-ray it first. That leg is hanging already by a thread or just by the superficial digital flexor tendon. Okay, you do not need an X-ray to see that bone is severed from its attachments. All right, complete fractures of the femur, complete fractures of the humerus in the adult horses over 300 kilograms. And complete fractures of the tibia in adult horses over 300 kilograms. Now, these fractures were considered as non-treatable. Hindi mo siya kayang i-fix. Okay? Complete fractures of the femur, the dynamics of the joint there and the muscles there are just very hard to get into. The complete fractures of humerus and tibia as well, especially for those horses who are over 300 kilograms. However, research, what do you call this? The book that I got these euthanasia indications is from 2015. However, in 2019, I believe UC Davis has been developing ways of treating such fractures which were originally considered as non-treatable. Okay, so they're still developing it. They're doing experimentations and studies to it. So hopefully in the future, these fractures which were considered as euthanasia indications will not be indications for euthanasia anymore. Hopefully. If you're thinking, how do we fix this and that? How did we fix canine and feline fractures? Plating, IM pinning, casting, and that is the focus of your group surgical report, which I will be discussing at the end of this lecture, right? Injury classification, this is what I discussed, the levels of injury, right? And basically, you divide the legs, the limbs of the horse into levels, okay? Which would include certain parts. So let's start with the most distal area, level 1, okay? If the injury is found on that area, which would be the distal metacarpal or metatarsal and the phalanges, fetlock joint, and any injuries to the extensor and flexor tendons of the metacarpal and metatarsal areas. Level 2 would be mid-metacarpal to distal radius, carpal joint, which is that, the big knob there, and the mid to proximal metatarsus. Going up to level 3, that would be mid to proximal radius in forelimb, or the tarsus and tibia in the hind limb. And level 4 would be upper, right? Proximal to and including the elbow joint. In hind limb, it will include the stifle joint, right? And this is, it's not necessarily a fracture, huh? It could be a luxation, it could be a small, it could be a fracture, but it could be of different kinds of fracture. It could be complete, it could be an avulsion, it could be like a green stick lang dun sa mga splint bones. That is included here. That's why it's an injury classification, not a fracture classification, right? So when you see this, when you see a lame horse in the field, what do you do for acute injuries, right? Number 1, you have to relieve the anxiety. You could use your meds, you could use proper handling as well, you could use both, right? If you notice that there is instability of a certain bone or group of bones on a limb, you have to immobilize that area, including the joint proximal and distal to that area, for transportation and for further studies or further diagnostic techniques. You have to prevent further tissue damage, which would happen if that fracture is still mobile, and you have to provide safe transportation. Coaptation would be will be incorporated into one of the goals. Which one? The coaptation. Number 2, yes. Emergency coaptation is actually the level of injury earlier would define the method of coaptation. And this is only indicated for short-term limb immobilization. Okay? It's just from the field to the clinic or to the hospital. Right? And what is included here? Appropriate wound care if there is an open wound, provision of adequate padding, immobilization of the joint above and below area of injury, prevention of lateromedial and craniocaudal motion of the fractured bones, or if any bone, any bone associated with the injury, and the cleaning of the open wounds, debridement and covering of gauze bandage. In the field, all right? I don't expect you to get your scalpels and debride the wound, all right? How it's done in the field, if you have open wounds, even if it's not a fracture, okay? Just wounds. You clean it with water. You remove the soil, you remove the dirt, you clean it with water. Then you cover it. Cover it with your gauze sponges, gauze bandages, and then you cover it like that. Okay? That's basically like a modified Robert Jones bandage. Right? So this is what I said when I said the bandage and splint application would be dependent on the level injury system of the horse. Right? They're just summarized there. So in applying bandage and splints, what do we need? If you still remember, you have the cotton padding, you have a stretch gauze or the conforming gauze. Okay, this will compress or secure your cotton padding. Right? Non-elastic bandage, usually that's your vet wrap. Yes, there are some vet wraps that are so big. The vet wraps that you saw were like just what? 1 inch, 2 inch, just 2 inches in width. Then you have the bigger ones, like 6 inches in width. Yeah, that's what we use in horses. Tape, casting tape, and splints, right? We'll discuss splints in the next slide, right? The Robert Jones bandage is the mainstay coaptation of emergency injuries in horses, right? Yun yung laging ginagamit, okay? So how do we do the RJB? Okay, if you still remember, first layer would be cotton padding. You start from the most distal part of the injured limb, going up with 50% overlap from the first layer that you put on. Okay, 2 to 3 layers can be placed on the limb of the cotton padding, which you then compress with the conforming gauze. Okay, and then you cover it with vet wrap, which can then be secured with non-elastic tape. Okay, since this is a horse, okay, the usual tucking of the vet wrap sometimes won't work. So usually what equine practitioners have in their toolboxes would be duct tape. Okay? Now, that's just a simple bandage. Okay, this is applicable for fractures or for really fractures, wounds. Okay, when you see a wound. Now, for fractures, it falls under those levels. Okay, you can use a splint. Okay, what is a splint? This is a hard, not necessarily long. This is a hard object. It can be made of wood, PVC pipe, or metal, which you could place on the area which needs to be immobilized. Okay? If you believe that those bones have a displacement which is pointed laterally, yung naka-point sila laterally, okay? Then you put a splint on the lateral side. If you think that that bone, when this horse moves, when it tries to move, will go caudally, then you put a caudal splint. Okay? So you put this on top of the Robert Jones bandage. Okay? So you put the cotton padding first, like here. Okay? Or the Robert Jones bandage was placed. Alright? And then the splint was attached. Right? The splint, depending on the area, it could go from up to here or just here. Okay, we'll discuss this per level later. Right, and then you just secure it with duct tape. And now your patient is stabilized, the fracture is stabilized for transport. Okay, and depending on the situation, a fiberglass cast can be placed on top of the splint for further immobilization. But of course, it will depend on the practice that you are observing. Right, so let's now discuss how we will immobilize every injury level. Right? Level 1 injury. Okay? Immobilization of a level 1 injury, which includes phalangeal fractures, fetlock, pastern or coffin joint luxations, and if it severed one or more flexor tendons. If it severed one of the extensor tendons, it requires a certain they call this splint, which we'll discuss in a bit. Iba yung approach kapag extensor tendon. Okay, so how do we place it? So imagine this is your this is the limb, right? We are looking at, I believe, either lateral or medial view of it. All right, so you have to align the cannon bone with the phalanges. Okay, usually this one would be angled this way, like that. Remember the normal equine foot? Right? So you need to align this. Okay? It's very important for you to either sedate your animal, give pain meds for this, for you to be able to do this. Okay? But this is needed before you actually transport your animal to a hospital for checking or for the actual therapeutic plan. Okay? All right, the bandage and the splint is applied. Okay, the bandage is this thick grayish area here. The splint is this one, right? And this is placed on the cranial aspect of the distal limb to prevent this coffin joint, no, pastern, yeah, to flex. Okay, you're preventing this one to flex. You want to keep it extended. That's why you have the splint. Right. If there is also lateral-medial instability, depending on the fracture, remember, you don't see it from the outside. You can also apply a splint here as well. Okay. Now, the horse will bear weight on this. Remember, most of their weight will be carried by the forelimbs. So you have to make sure that the bandage is well padded and snug to prevent loosening. Right. Now, how about the hind limb? The hind limb, first of all, would have a reciprocal apparatus. Okay, the reciprocal apparatus is a part of the stay apparatus. Okay, the stay apparatus is a system. Okay, a part of that is the reciprocal apparatus. I don't know if Anat covered this one. I know they covered stay apparatus. Okay, this prevents the extension of the distal limb when it is non-bearing. Okay? So the muscles and tendons of the stifle, okay, will also flex the hock. And same for extension. So the muscles that are required to flex this joint will also flex this one. Right? That's why it's reciprocal. Extend the stifle, you're gonna extend the hock as well. Right? And when the stifle is it stopped. When the stifle is, what do you call this? Extended, usually that is I'm gonna remember the muscle. Hold on. The vastus medialis will lock in your patella, right? Will lock in your patella to prevent it from moving. Kaya ka may stay apparatus. And then, when that muscle gets tired, the horse just shifts to the other leg for it to stay. Okay? Kaya siya stay apparatus. That's how they enable themselves, standing the whole time. Right? There is a sharing of the weight. So how do we do this? The splint is applied on the caudal aspect of the distal limb, from the toe to the point of the hock. Right? So again, if there's lateromedial instability, you place another splint here, and then you secure that with a tape or with fiberglass cast material over the splint. Now, some parts of the bone, if it gets fractured, split bones, a part of the distal phalanx, it can be treated just with a cast, right? So later I'll discuss. You're gonna be the one researching that, right? And of course, if you need to do a cranial splint, okay, you need to draw the limb forward for you to be able to do that. Now, the Kimsey Lifesaver Splint is a commercially available splint, basically. Look at that, right? Some made of metal, let's see, okay? This is indicated for level 1 injuries for prolonged immobilization, okay? So it's fitted into the animal's limb, okay? It's supported. Now, what is very important with the Kimsey is that since the horse will try to bear weight on it, you have to make sure that apparatus will not slip. So in whatever kind of bedding the horse has. So you could make sure that the stall is deeply bedded. Or a non-slip tape, like they put a sock here. Para siyang, parang nirap lang din ulit nila ng certain kind of vet wrap. Not really vet wrap, but kind of vet wrap. It can be placed on this foot to generate friction. Okay? Level 2, let's go up. Level 2 injuries would include cannon bone fractures, wounds of the carpus or hock, olecranon, that big caudal bone there, and radial nerve paralysis. Okay, so forelimb, how do we do this? From 1 splint to 2, we are going to apply 2 splints lateral and caudal at 90-degree angles to each other. Okay, to each other. The splint must extend from the hoof to the elbow. For olecranon fractures, of course, you need to put, you only need a caudal splint here. And for the hind limb, you're basically doing the same thing, but your splint would extend from the hoof to the big one here, to the stifle, right? All right. As you can see, okay, if you notice, the splint here only goes up to the hock, right? Why? Because it's hard to put it up to the level of the stifle. Basically, that's their only reason. It's difficult because of the angle, right? This is eternally a little bit flexed, so it's very hard to put a splint there. And this is you increase the musculature of the horse as you go up, so that helps in the immobilization. Level 3. This includes radial or tibial fractures. What happens here when your radius or tibia are broken? The flexor muscles, SDF, DDF, do you know what I'm talking about? The superficial digital flexor, the deep digital flexors become abductors. So when we say abductors, they will try to move the limb away from the medial plane of the animal. So this will lead to the displacement and the comminution or pagkadurog ng medial aspect of the limb. Alright? Dahil napupunta yung force to the lateral, nadudurog yung nasa gitna. Okay? So you want to, the goal for immobilization here is you want to prevent the limb from getting abducted. So here, so what do? You put a splint on the lateral side of the forelimb. Okay? Quite easy. For hind limb, you also put on the lateral side from hoof to hip. Okay? So yung mga malalaking plywood, I don't know, that's a dos. Yeah, or 4-2. I'm not sure. Yeah, it's like a 4-inch by 2-inch wood. Okay? That you saw earlier in the pictures. Yeah, that would do. That's for level 3. Or even if you're just suspecting. Okay? Kasi pag hindi mo pa alam kung nasan talaga yung injury. You know, you could try for crepitus all you want. You could feel for pain all you want. It gets harder to identify fractures as you go proximally. Dahil kumakapal yung muscle. So, it's better to just immobilize the whole thing. Okay? Level 4. Okay? The level 4 injuries would include fractures on the scapula, the pelvis, and the femur. Right? External coaptation here is not recommended, either above or below the fracture. Okay? Number 1, the big amount of soft tissue here is really good for immobilizing the broken bone. Okay? You rely on the hematoma because there will always be a hematoma there, because once your bones break, the blood vessels gliding across it would also break. Okay? So that will cause hematoma. Any swelling would also help for immobilization. And increased motion in the fracture site, which happens, okay, when it happens, can lead to vessel laceration, and that can lead to fatal hemorrhage. Okay? When you, so, ang tanong, pwede ko ba daw lagyan ng splint sa baba? No. Right? If you think there is a level 4 injury, there's no need for you to stabilize yung nasa baba. Why? When you put a splint or a bandage on a distal limb, which the horse doesn't need, okay? It will make the horse more awkward to move, and that can increase motion at the fracture site because it will try to readjust. And that could lead to that more significant hemorrhage that you're not that originally did not happen with the original fracture. If a fractured pelvis is present though, okay, like in humans, that needs to be stabilized first. Usually you put we call this, there's this tie, gosh, I forgot. I'm studying and I forgot. You tie the pelvis, it's like you're compressing the pelvis together medially para hindi siya gumalaw-galaw. Okay? But that's, I'll try to put it in the Google Classroom na lang. Because it's kind of challenging to do. Kasi it's this area wherein the horse can kick. Right? But they get a long cloth or a gauze bandage, but it's really a long cloth, and then they wrap it around the pelvis of the animal, and then they tie it. Quite tight. Right? Yun. And there's a lot more, call this, vessels in that area as well. Okay, so transport. How do we transport? It's very common to have slant load trailers or the 45-degree trailers for transport of horses. You could actually put an abdominal sling inside para hindi siya maging unstable during transport. Okay? Para walang weight dun sa injured limb. Alright. What else? If the horse, though, is recumbent, okay, usually you put it on a tarp or a blanket. Then you pull it into the trailer, and you have to protect the head and the limbs because they would try to move If this is recumbent, you sedate them. You keep them sedated during transport to avoid injuries. Okay, protect the eye, protect the head from self-inflicted injuries. You can bandage the lower limbs to avoid trauma, which happens when they paddle, which they will paddle when they are sedated. All right, I said brief. I said brief discussion. That's a brief discussion. Okay, we're due for a group surgical report for you guys, and I hope you can follow instructions this time. I don't want to cast shade, you know. I don't like being that person, but sometimes when a lot of people do it, it's just infuriates me when simple instructions can't be followed, you know. Gano pa ba kasimple ko pwedeng sabihin or i-express or i-type ang mga instructions para maintindihan nyo. You know, if I put it into the system that you are familiar with, na tipong any instruction that you will break or will not follow will cause a 10-point deduction. Baka lahat kayo, diba, mag-follow na instructions. You always live by consequences, which is, I don't know how you live by that. No? Grades are not everything, but how you react to things, how you do things matter. I don't know. It's getting difficult to care anymore, you know? It's getting difficult to care right now. So when I stop ranting about these things, then you know that you've filled me with so much what do you call this? Inis, that I just simply stopped caring anymore. Okay? Group surgical, don't even get me started with your exams. I don't know how you're doing your exams. Are you in a group chat while you're doing your exams? Fine, right? But please, when you answer it, don't have the same copy word per word for like 3 students. No, you answered the same thing in the bonus with the same thing. I don't know which I don't know if you copied or pasted it from the internet, you know. But at least paraphrase. Come on. I gave you a week to finish this. Yet, some of you still submitted 10 minutes past, 30 minutes past. You know, I give you allowance only for you to use for other things. And you're gonna cram it anyway. Then might as well I'll just give you 2 hours to answer the exam. Diba? Because it's like an invitation for you to procrastinate. It's hard to position myself that I want to be kind, and then I don't see any benefit to it, rather than you seeing it as a way to procrastinate, or I'm not gonna think of it for now. I have 6 days to answer it. I'll answer it 30 minutes to go. You know, I don't see that. I don't get that. Maybe I'm old, but I don't understand. You know, I cram as well. But don't you, isn't it easier for you guys to, you know, nawala na kayong alalahanin pag may nangyari? Anyway, your group surgical report, remember you created groups. Groups of 4, some groups of 3 in the start of the semester. I will give you a choice of topics, and you have to submit a presentation, okay, basically like this, in a PDF form, on a surgical repair or correction that you have researched about the topic, which includes pre-op considerations, and your pre-op considerations are quite big because that includes evaluation, that includes diagnosis. What will I see if I put this animal on an x-ray? How would you know that that is a fracture of the distal phalanx? Things like that. If it includes a surgical technique, at least a brief discussion on that, right? Positioning, surgical approach. I forgot. Anesthesia is also part of pre-op considerations. Any fasting that this horse needs to get into. Is this an emergency procedure that you need to get into right now? You know, those things that we usually discuss in pre-op. Surgical technique. of course, surgical approach, surgical positioning, equipment that you need, right? If you want to play into a Philippine setting, that's fine, but you're not gonna see a lot of surgical techniques if you focus just in a Philippine setting. So go out, right? Go outbound. Research what other countries are doing. And of course, after that, you have to discuss any post-op management and any complications, right? Unless the topic that you choose is a non-surgical one, which you will see later. There are some which the correction or the repair is a non-surgical one. So it's up to you how you're gonna figure that out. Please follow the same format and appearance of our lecture videos. It might be a stretch, but I hate seeing reports in PDF. Na may background na pattern, keep it white, all right? At least keep it as a white background. You do not have to do the thing that I do here na meron akong header and there's a line. You know, you can, what do you call this? Deviate from that. But at least keep it as a white background. Kasi ang sakit po sa mata. Ang sakit po sa mata. I don't want to use glasses. I'm very lucky at this age na hindi pa ako nag-glasses, alright? A maximum of 2 groups can choose the same topic, right? If you want to collaborate, for 2 groups collaborating, fine, but you still have to submit to me separate files. Alright? How you're gonna make it your own, if you want to do your research together, that's fine. If you want to, how you're gonna collaborate, that's on you. If 2 groups are gonna choose the same topic. Now, how do we reserve this? How do I call this? Watching the lecture video really fast, okay, really early has its benefits because now you know that there's a group surgical report. Right? The reservation of topics need to be done via the FB group chat para alam ng lahat kung anong topic ang may naka-reserve na, right? At ano pa yung wala pa, right? So I just need the name. It doesn't need to be the group leader who reserves the topic, but I need the name of the group leader, all right? Across the topic. Alright? Or just anyone in your group na lang. I don't know if your group members actually know who the group leaders are anyway. Alright. So, for submissions, only the group leader will submit the file to my email. Okay? Ito na naman tayo sa instructions. And this is on or before June 7, 6 p.m. Which you might think is quite far. It's not. It's just a month away. Yeah. Then tapos na ang SEB. Oh, yes. Tapos na ang SEB. I can rest. Yeah, I'm not taking, I'm gonna stop teaching next semester. I cannot. Right? Now, let me give you some, what do you call this? Silver lining. Alright? For you to have some effort naman sa report. Okay? Now, if you're gonna do it this way, because your report is gonna be done in PowerPoint, and then you're just gonna save it in PDF. Now, if you're going to discuss it this way, record that PowerPoint, export it as an MP4 file, send it to me as a PDF, your entire group, okay, will receive an unparalleled benefit. And I say unparalleled, it's unparalleled. I'm too kind to do this, but I'm giving you a free shot here, okay, during the end of the semester. All right? So it's up to you if you want, up to you if you don't. But because I know that reports need to be reported, and ako nga hindi ako nagla-live Zoom ba't ko pa kayo na-require na mag-report? So you could just record it this way, send me a file. If it's too big, upload it in YouTube, send me a link, keep it unlisted or private, it's fine. All right? And you, not just the leader, but the whole group will receive a benefit for during the end of the semester, which will be announced on the end of the semester. Right? So here come the topics, and this is associated with this one, all right, with fracture management and coaptation. Right? Layman's examination in horses, actually the easiest one here, because you're just gonna tell us how how to examine lameness in horses. Imaging techniques, I expect a lot of pictures for this topic. I expect that it's not just x-ray that you're including in this topic because there's a lot more. Mandibular fractures in horses is actually more common than you thought. That's why I included this here. Bruised sole, when I said solar bruise earlier, actually the sole, and corns in horses, right? Fractures of the distal phalanx, fractures of the first and second phalanx, which you think would have the same. They have the same level 1 injury, but the treatment plan is actually different. Fractures of the splint bones, you know, the second and the fourth metacarpal and the second and fourth metatarsal bones, those are your splint bones. Yung naka-fuse sa medial and lateral side ng cannon bone, right? Fractures of the cannon bone itself, right? Fractures of the shoulder, elbow, the proximal sesamoid bones, which you might think is not common, it actually is. There's a big chapter of it in a book. And puncture wounds of the foot, right? So again, hindi siya lahat fractures. Meron dyan can cause severe lameness, which could be mistaken as a fracture. That's why I included there. And again, for your topics, 2 groups can share 1 topic, right? It's up to you. I'm not stopping you from collaborating with the other group that shows the same topic, right? You can do as a group work, but I would still need 2 files, right? 2 different files. Wag yung same file tapos iniba nyo lang yung file name, ha? Alright? So I think you have the rest of the SEM to do this. Next week, I will try my best to start with gastrointestinal system of horses and ruminants, right? Which is, I think, the biggest chapter. So I will try. All right. Thank you all. If you have any questions about this report, about this requirement, just let me know. I will message you or I will reply to you as soon as I can. And I will see you as a recording again by next week when we discuss equine gastrointestinal system. All right? Okay. Thank you all and have a good week. Bye. Racetrack. What do you think? All right. Luckily, no, this one died. This one was killed on the field. Luckily, we have some better not. Equine, what do you call this? Practice is very hard, right? In my batch, 1 attempted, but now he has a clinic. The batches before me, who graduated before me, attempted to be, to intern themselves with equine practitioners, but the thing is, yeah, they went to small animal clinics na din. I don't know. It's because not a lot of people in the Philippines have horses, not like dogs and cats. Everyone has dogs and cats. But basically, if you're already a known equine veterinarian back home, ikaw usually yung may alaga ng lahat ng mga horses. Usually. Alright? Next, I'm